Hi, my name is Michelle Ginsberg. I'm a radiologist and I'm Director of Cardiothoracic Imaging and Vice Chair of Education at Memorial Sloan Kettering Cancer Center in New York City. Well, it's important to classify the nodules as being incidentally detected in a group of individuals that are just getting a scan for other purposes, and those that are part of a screening program. Those that are part of a lung cancer screening program are already high-risk individuals. So the nodules that are identified in that group are certainly more at a higher risk. And therefore, we use guidelines, which is the LUNGRADS guidelines, which has 4 different categories. And the follow-up of those nodules is related to the size of the nodule, the appearance of the nodule, and the interval to follow-up may vary from a 6-month follow-up, a 1-year follow-up, or even further imaging with a PET CT or a biopsy. Now, nodules that are found in a non-screening program, that could be anybody getting a scan for other reasons, and a nodule is detected, those should be followed by the Fleischner Society pulmonary nodule recommendations. And those are specific recommendations based on whether it's a small solid nodule, which has specific guidelines with follow-up, and those that are maybe part solid, nodules that have some appearance that's not really solid and so-called ground glass, and those have different follow-up which may extend to a longer period, not just a 1-year follow-up, but may even need to be followed up for 4 years. Now, the Fleischner Society guidelines have exclusions, and they're not meant to be used for patients that have 35 years or younger, because the overall risk of malignancy in this age group is low. Most nodules in this group are probably infectious rather than cancer. And incidentally found nodules in a group that's under 35 need to be individualized. You can't apply these guidelines. And the same goes, they don't apply to those with a known malignancy, because someone who has a known malignancy and you detected incidentally detected nodule, it's more likely to be cancer related than in a general population. Similarly, in immunosuppressed patients, if a nodule is detected incidentally, again, the guidelines cannot be applied because they have a higher risk of other opportunistic infections. And as I mentioned, a lung cancer screening population is not part of the Fleischner guidelines, but rather uses the LUNGRADS reporting system.